Good morning, everyone. My name is Stephanie Top and I work at the Centre for Infectious Disease Research in Zambia. And I'm presenting today on a component of my PhD research which asked, has HIV scale-up improved accountability in primary health centres in Zambia? So as many of you would know, the past decade has seen massive investment in HIV care and treatment services in many sub-Saharan African countries. And more recently, this investment has come with claims that HIV programs are having a health system strengthening effect. Now, at the primary health centre level, a strong system is typified by good quality and responsive service delivery. And one of the key mechanisms that underpins good quality and responsive service delivery is accountability. Without effective mechanisms of accountability, primary health centres may deliver inconsistent, unsafe, and ineffective care. So, in my study, I asked whether the introduction of HIV services into primary health centres improved accountability in these settings. But what is accountability? Accountability is the product of two sets of mechanisms. First, mechanisms of answerability that produce information to enable managers or patients to understand how and why health providers have been performing. And secondly, mechanisms of enforceability that produce rewards or disciplinary measures based on whether or not that performance is considered above standard or below standard. Now, in the primary health centre setting, providers may be accountable to their managers and supervisors for ensuring that national clinical service guidelines are followed, and this is upwards or performance accountability. But providers are also accountable to their clients or patients, and this type of downwards accountability is sometimes thought of as social accountability. So I conducted a multi-case study in 4 Zambian health centres with data collected from provider and patient interviews, observations and document review, and I triangulated these to produce case descriptions and cross-case analysis to understand how HIV services influenced mechanisms of answerability and enforceability in those health centres. I looked first at performance accountability or upwards accountability to managers. I found that HIV services improved answerability in the HIV departments through in-service training, e-medical records, quality assurance and clinical mentorship that improved health providers' ability to carry out their duties and record and produce information that demonstrated this performance. HIV services were also initially associated with top-up payments for working in HIV departments, and these acted as a reward or positive sanction for the first few years of HIV operation. However, the improved answerability and enforceability in the HIV departments had little or no spillover effect into other health centre departments. There, collection and collation of routine service and performance data was still dependent on cumbersome paper registers that were complicated and contained multiple duplications, and as a result were frequently incomplete or just ignored altogether. Nor did the investment in HIV services improve mechanisms of enforceability in the clinic. With few effective disciplinary mechanisms available to them, health centre managers faced chronic problems enforcing clinical standards and encouraging teamwork, and absenteeism was a chronic problem. As well as performance accountability, I looked at social accountability. Remember, this is a type of downwards accountability that implies providers' responsibility to meet needs and expectations of their patients. So first, in a system where there remains significant confusion and corruption in relation to informal fees, answerability in the HIV departments was strengthened by the almost universal recognition of the fact that patients should have free access to HIV services. And this was the product of a very public announcement by the then Zambian president regarding the new Ministry of Health policy. Answerability in the HIV departments was also influenced by the rights-based discourse surrounding the disease, with many providers describing HIV patients as vulnerable or special, and reporting a sense of responsibility for ensuring they received good care, compared to many HIV patients who were also better informed and more confident to voice complaints when they felt that services were below expectation. Despite these improvements in the HIV departments, however, mechanisms of social answerability and enforceability in other domains of the health centre went relatively unchanged. Mechanisms like patient feedback boxes and neighbourhood health committees continued to be weakened by information and power asymmetries, as patients or community members had either insufficient information or insufficiently empowered to challenge common service practices. So the introduction of HIV services clearly had some positive impacts on performance and social accountability. But why did it not strengthen these things across the health centres as a whole? Well, a key feature of HIV scale-up was its strong focus on health systems hardware, drugs, infrastructure and training. But there was a relative lack of investment on mechanisms of software, shaping the attitudes, norms and values of the frontline health providers. This system software is ultimately what shapes the quality and responsiveness of care. The importance of system software was demonstrated in this study with findings showing how the removal of HIV overtime payments in 2010 resulted in the creep of work patterns common in other health system departments, such as apathy and absenteeism, back into the HIV department itself. So, if disease-specific interventions, such as HIV service scale-up, are to actually have a health system strengthening effect, they must strike a better balance between the current preference for investing in the obvious material deficiencies of the system on the one hand, and the urgent need to invest in research and interventions to address gaps in health system software, such as mechanisms of accountability that may be found embedded in governance structures and leadership capacity at all levels. Thanks, and I welcome feedback at this email address.